would mean over 4 years, around 460 new physicians trained right here in Iowa.
A bill Governor Reynolds campaigned for during the legislative session will soon be ready for her signature. Good evening, I'm Janae Town.
I'm Erin Kiernan. Thanks for being with us. The legislature is finished for the year, closing with a marathon session that ended around 6:30 this morning.
Lawmakers approved several bills while you were sleeping, sending them on to Governor Reynolds. WHO 13's Griffin Wright joins us now. Griffin, Governor Reynolds says one bill she plans to sign is critical to rural Iowa.
Yeah, that's right. The goal of the bill is to get more doctors working in rural communities. I've talked with medical professionals all across Iowa to find out the full impact that the bill could have.
Iowa has a serious problem, a shortage of doctors.
Iowa is 44th in the nation in terms of the patient-physician ratio. It's a real crisis.
The governor and Iowa legislature just passed their solution with a new bill adding 460 residency program slots over the next 4 years.
We know that where a physician trains is the biggest predictor of where they're going to practice. And so by having more residency programs in Iowa and having them be spread across the state, we believe that this will help increase the number of physicians practicing in Iowa.
Dr. Kyle Grover, a resident at Iowa Lutheran Hospital, is proof that the ideas in the bill can work.
I'm here doing my residency at Iowa Lutheran with Unity Point in Des Moines. I spent some time in Winterset, Iowa, at Grinnell Hospital as well.
And Grinnell Hospital is where Dr. Grover will practice when he finishes his residency. He's benefiting from a program that will soon see a boost in funding.
It's increasing the number of dollars into the loan repayment fund. Average medical student graduates with over $200,000 in debt, and this encourages medical students to practice in underserved areas, and if they serve there for 5 years, they're going to get their medical student debt paid off.
Dr. Kathy Lang, a doctor who's practiced in Centerville for decades, says residents need to know what rural Iowa has to offer.
We need to increase exposure to rural communities, and by that I mean in medical school, spend a little more time in rural communities finding out what it's about.
That exposure is vital for rural hospitals looking to recruit doctors like Cass Health in Atlantic, Iowa.
Med school students, and we have residents who come through our program. Usually the rotations here are short, but often that's part of our recruitment process.
Exposure is also what brought Dr. Grover to Grinnell.
I went to Grinnell and got to spend some time there. It's the people, it's the place that really draws you in.
And what will keep him there?
My plan would be to spend my entire career there. That was my goal when I was looking at places for where to practice, was a place that I could make my home and raise my family. And so I think that my plan in 5 years will to still be in Grinnell.
Yeah, so Dr. Grover really is kind of a poster child for how this can all work, getting more doctors out in rural Iowa, planting roots and starting careers.
Okay, that's where it starts. Thanks a lot, Griffin.